Hello my dear curious and studious students of surgery. Myself Dr. Mahesh Chaudhary. I am warm welcoming you in my surgery lecture series. This surgery lecture series contains entire surgery with anesthesia, with radiology, with orthopedic. So stay tuned with us. Let's start our surgery lecture series. Welcome dear students in my surgery lecture number 70, that is the wound management. In this lecture we will cover the wound healing, types of the wounds, factors influence the tensile strength of the wound, healing of the skin wounds, complications of the wound healing, implantation cyst, painful scar, cicatrization of the wound, keloids formation, neoplasia, that is common cell carcinoma, and the factor influencing wound healing. All these points will cover in this lecture. So start with me the wound management. First we will see the wound healing. The word healing means replacement of destroyed tissue by the living tissue. Wound may be caused by trauma, either accidental or surgical. Second is the physical, chemical or microbial agents which gives rise to the inflammation and may lead to necrosis or destruction of the living tissue. Third is the ischemia which leads to infarction. In the context of wound healing, two terms should be understood. First is the regeneration and second is the repair. Regeneration, which means the replacement of lost tissue by tissue similar in type. These occur due to the proliferation of the surrounding undamaged specialized cells. The term regeneration should not be confused with the term reconstitution, which means coordinated regeneration of several types of the lost tissue resulting in reformation of whole organ or the limb. Second term is the repair, which means replacement of lost tissue by granulation tissues followed by the fibrosis and scar tissues formation. This occurs when the surrounding specialized cells do not possess the capacity to proliferate, that is the neurons and the muscles, or the destruction of tissue to such an extent that proliferation of the surrounding undamaged cells cannot make good the loss. Now the next point is the types of the wound. There are multiple types of the wound like incised wound, lacerated wound, penetrating wounds, crushed wounds. First we will see the incised wound. These are usually caused by a sharp knife or glass. These wounds may be closed by primary sutures if the wound is explored within the 6 hours of its occurrence. With this period, all damaged tendons, nerves and major vessels should be repaired. Second is the lacerated wound. These wounds are commonly occurred following road traffic accidents. The wounds usually have jagged edges with certain lacerated and devitalized structures inside the wound. And third is the penetrating wound, are almost similar to the incised wound except that its depth is more. The wound should be explored layer by layer followed by the primary suturing if it has come within the 6 hours from the injury. And the fourth is the crushed wounds. These occurs due to the industrial, road traffic or war injuries. These wounds are managed by the debridement and removal of all necrotic tissues. Dear students, here is the image of the wound types illustration on your screen. Various types of the wound is clearly seen, that is the incised wound, by the surgeon, lacerated wound, penetrating wound and the crushed wounds. Now the another image is showing the types of the wounds. First is the cutting wounds, second is the stabbing, stab or cut, torn, bitten by the creatures, chop, crush, hurt wound, firearms, scalp and surgery wound, wound after the surgeries, then the poison. All types of wound images are here. Now the four basic processes which take place in the wound healing are inflammation, wound contraction, epithelialization, granulation tissue formation and skull remodeling. Although all wounds heal by the same basic processes, yet their application is different in closed wounds and open wounds. There is a big difference between the closed wounds and the open wounds. First process is the inflammation. Immediately after the disruption of the tissue integrity either by accidental trauma or by the surgeon's knife, inflammation starts. Platelets become adherent and with clotting factors from a hemostatic flux to stop the bleeding from the small vessels. Clinically, the inflammation is presented by the redness, tenderness, heat, swelling and loss of function. Second process of the wound healing is wound contraction. Wound contraction with tissues has been noticed in the open wounds with tissue loss for centuries. Only recently, however, the mechanisms responsible for the wound contraction have been investigated extensively. This period when no wound contraction is noticed as called the initial lag period. After this period, there is a period of the rapid contraction which completed by the 14th week. Now, the next point is the causes of the wound contraction, that is the removal of the fluid, contraction of the collagen, contraction of the granulation tissues. First, the removal of the fluid by drying has been suggested as the cause of the diminution in the size of the wound, but this has not been substantiated as the water content of the central wound tissues at the beginning of the wound contraction has not changed significantly as at the end of the contraction. Second is the contraction of the collagen has also been incriminated As the cause of the wound contraction, although collagen increases markedly between 5th and the 8th day of the healing, yet the total collagen in the wound falls significantly after this period. And third is the contraction of the granulation tissue. That contraction occurs at the time when granulation tissue is actively being formed, has led many workers to regard the granulation tissues as forming an organs of contraction. Now the next point is factors inhibiting wound contraction. The factors inhibiting the wound contraction, those are the corticosteroid administration has inhibitory effects on wound contraction, it delayed the wound healing. Contraction does not occur normally in burns. Immediate skin grafting prevents wound contraction. X-ray irradiation, if applied on the wound, cause delay in wound contraction. Next factor inhibiting the wound contraction is the trosinate, which is the smooth muscle inhibitor, acts on actin, which is the contractile protein of the myofibroblast, also inhibits wound contraction. Next point is the colchicine or vinblastine, also inhibit wound contraction as they are inhibitors of the microbial formation in the microbial. Next point in the factors of the inhibiting wound contraction are cytotoxic agents, particularly the cytochrome poisons is non-lethal doses inhibit the wound contraction. Next point of the process of the wound healing is the epithelialization, that is the third point. In skin wounds, the epidermis immediately adjacent to the wound edge begins thickening on the first day. Marginal basal cells lose their firm attachment to the underlying dermis, enlarge and begins to migrate into the wound. Next point is the granulation tissue formation. The hematoma within the wound is soon replaced by the granulation tissue, which consists of new capillaries and fibroblasts. This formation of the granulation is preceded by two phases: phase of the traumatic inflammation and phase of demolition. First, the phase of the traumatic inflammation. The details of this traumatic inflammation has been discussed earlier in this section. Second is the phase of the demolition. The dead tissue cells liberate their autolytic enzymes. Similarly, disintegrating polymorphs liberate proteolytic enzymes. Third is the granulation tissue formation. The granulation tissue is mainly formed by the proliferation and migration of the surrounding connective tissue elements. The two stages are considered in this process are stage of vascularization and the stage of the devascularization. First is the stage of the vascularization. As mentioned above, the wound clots is invaded by the microbes, which is with their phagocytic activities remove the particulate matters and moves towards the center of the wound. This process is followed by the capillary loops and the fibroblast. The ingrowth of capillary loops and fibroblasts, which help to form living granulation tissues, is known as the organization. And the second point of the granulation of tissue formation is the stage of the devascularization. At later stage, these mast cells disappear and hellenization occurs. There is also formation of the scar tissue. This process is known as the cicatrization. Collagen turns over the remodeling in the scar never stops. In fact, the turnover the collagen is scar tissues is faster than the other tissues. Now, the next point is in the wound healing process are the scar remodeling. This is the last stage of the wound healing. Approximately 12 hours after injury has occurred and when the inflammation is established, epithelial migration, which is the first clear-cut sign of the rebuilding, occurs. In the primary wound, epithelialization is complete in few hours. In the secondary healing wound, migration of the cells is rapid as the line of the cells from the wound margins become extended, but progress becomes slower, so that the days or the even weeks may elapse before epithelialization is complete. Now the tensile strength. The next point of the wound healing is the tensile strength. The strength of the healing wound is of great practical importance to the surgeon. It acts as the main safeguard against the wound dehiscence. In the first few days of the strength of the wound is only that of the clot which cements the cut surfaces. Towards later on, various changes takes place in the wound healing process. As mentioned above, and at the end of the tensile strength of the wound corresponds to the increase in amount of the collagen present. Many factors influence this tensile strength of the wound. These are the direction of the wound, pull of underlying muscles and previous wounds and abdominal binders. First is the direction of the wound. Skin wounds parallel to the lines of the larger heal faster. Skin incisions made across larger lines tend to gap and their healing is delayed. So always remember the incision should be made on the largest line. There is no chance of the healing or delayed healing. tensile strength of the wound becomes more when this is the parallel to the lines of the linear. That is why the transverse abdominal incision produce stronger scar than the longitudinal ones. Next point in the tensile strength is the pull of the underlying muscles. The wound which are parallel to the pull of the underlying muscles constitute stronger scar. Third is the previous wound. Ruptured wound heal faster than those sutures primarily as the reparative process has already commenced. Fourth is the abdominal binders reduce the rate of the gain is in the strength. Now the factors affecting granulation tissue formation. First is the cortisone administration, second is the scurvy, and third is the protein starvation. The cortisone administration, excess corticosteroid administration inhibits the granulation tissue formation. And the scurvy, in this condition, though the vascular granulation tissue is formed, yet there is a failure of collagen formation. Maturation to collagen does not occur in the absence of vitamin C. And third point in the factor affecting granulation tissue formation, that is the protein starvation, also causes delayed formation of the collagen. There remains excessive accumulation of the poorly sulfated ground substances. Now the next point is the healing of the skin wound. This point contains the healing of the clean inside wound, healing of the open wounds. First we will see the healing of the clean inside wound. The edges of the which are closed, that is the closed wounds, takes place by the process of knowing as the healing by the first intention. The following changes takes place. First is the initial hemorrhage results in the formation of the fibrin rich hematoma. Second is the acute inflammatory process occurs and the fibrinous exudates helps to cement the cut margins of the wound together. Third point is the minimal granulation tissues is formed which can be called organization, and fourth is the regeneration of the epithelialization. The process of the epithelialization has been discussed as earlier in this lecture. Next point is the healing of the open wounds. If delayed closure is not performed and if there is a skin loss or remarkable change in the physical dimensions of the wound occurs, healing of such wound is known as the healing by the secondary intention. The main bulk of tissue which performs the healing process is the granulation tissues, and that is why this type of the healing is also called the healing by the granulation. Now the complications of the wound healing are implantation cyst, painful scar, cicatrization. It often produces various deformities, gillette formation, and neoplasia. Neoplasia, squamous cell carcinoma has been seen develop from the edges of the healing wounds. This may be due to the uncontrolled growth with invasive potentiality of the surrounding epithelial cells which are concerned with the epithelialization. Dear friends, here is the complication of the wound. Here is the first image showing the implantation cyst, second image showing the implantation cyst. This is the painful scar, complication of the wound. This image is the keloid formation. Keloid formation is clearly seen. This is the neoplasia, squamous cell carcinoma of the skin is clearly seen. This is also the neoplasia, squamous cell carcinoma of the skin, same neoplasia. Now the factors influencing the wound healing. The various factors which influence the wound healing can be divided into two groups, majorly general factors and local factors. First is the general factors, contributes age, nutrition, hormones, cytotoxic drugs, radiation. First, the age. Wound healing is the fast in the young, but it is normal in old age unless associated with the debilitating diseases or ischemia or diabetes, etc. Then nutrition, protein deficiency. Protein depletion causes impairment of the granulation tissues and collagen formation, but may be due to the excessive loss, that is the nephritic syndrome, cirrhosis, chronic inflammatory condition, etc. Then the vitamin C deficiency, as we discussed in the same lecture earlier. Vitamin A is required for proper epithelialization. Zinc, calcium, copper and manganese deficiency. Zinc is an essential component of many enzymes which are involved in protein synthesis. There is some failure of the granulation tissues formation in case of the zinc deficiency. Others are essential minerals which are also required for proper wound healing. These may be depleted the intestinal fistula and burns. Now the third factors influencing the wound healing is the hormones. First is the corticosteroid and second is the deoxycorticosterone acetate. Corticosteroids, the effect of this hormone on granulation tissues formation and wound contraction have been discussed as earlier in this lecture. Cortisone and its derivatives decrease the rate of the protein synthesis, stabilize liposomal membrane and inhibit the normal inflammatory reaction. High doses of the corticoids limit capillary budding, inhibits fibroblasts proliferating and decrease the rate of the epithelialization. And second point is the deoxycorticosterone acetate and anaplastic steroids like testosterone are also concerned with the increase in the speed of the wound healing. Now the fourth point in the factors influencing wound healing in the general factors, that is the cytotoxic drugs and radiation. Radiation effects of the other cytotoxic agents also influence healing rate. Local application of 5-fluorouracil can completely prevent healing. Following conditions delay or hamper the quality of the wound healing. These are the anemia, uremia, jaundice, diabetes, blood diseases, malignant diseases and cytotoxic drugs. Now the next point in the factors influencing wound healing, that is the local factors, which contain the position of the wound, skin wound, blood supply, tension and infection, and the movement, exposure of the ionizing radiation, foreign bodies, adhesions of bony surfaces cause delay in the wound healing probably by preventing the proper wound contraction, necrosis, limb drainage and ultraviolet light and faulty techniques of the wound closures. All these are the local factors. First, we see the position of the skin of wound. As mentioned, when the skin wounds are parallel to the lines of the lineage, they are heal faster, and if it is opposite, then it is the delay in the healing. Second is the blood supply. Wound with poor blood supply heals slowly. That is why the wound in the pretibial region takes much more time to heal, because there is a very poor blood supply. Next point is in the local factor in the wound influencing factor influencing the wound healing, that is the tension. If the wound is in the tension, it is healing will jeopardize hematoma and the infection increase tension. Next point is the infection. Once infection occurs in the wound healing is always delayed. It may be considered as the most important factor that delays in the healing. Due to the infection, fibroblasts face tough time to persist as they have to compete with inflammatory cells and bacteria for oxygen and nutrients. So proper granulation, tissue formation and collagen formations. This has been often the cause of the burst wound, which requires secondary sutures. Now the fifth point is the movement. Movement itself delays wound healing. So rest is very essential for wound healing. The delicate capillary loops of the granulation tissues and the delicate epithelium are damaged due to movement. Frequent changes of the dressing also has the same adverse effect and should be advocated. Movement also causes entry of infection. Next point of the factors influencing wound healing in the local factors are the exposure of the ionizing radiation. Previous X-ray irradiation may affect facility of the part. It also causes the delay in the formation of granulation tissues, but most important is that it inhibits wound contraction. 7 point in the local factors are the foreign bodies. These include the tissue reaction and inflammation. Its sutures are kept for longer period. It may cause aseptic abscesses. Then the next point in the local factors are the adhesions to bony surfaces causes delayed in wound healing probably by the preventing proper wound contraction. This is the particularly seen in the wound over the tibia. And the next point in the local factors which are the influencing factors of the wound healing is the necrosis. These obviously retard the healing. 10th point in the local factors are the lymph drainage. Impairment of the lymph drainage which causes edema of the part jeopardize the process of the wound healing. Elevation of such limbs often facilitate the wound healing. And then second last point of the local factors are the ultraviolet light is well known clinically to increase the rate of healing. This has been confirmed experimentally. So the extraviolet light should be taken, and it is the free for us on the creatures on the earth by the sun. So it is the clinically experienced. Faulty technique of the wound closure is obviously responsible for delay in wound healing in many cases. Dear students, all these are the local factors influencing the wound healing process. Here is the end of our lecture number 70, that is the wound management. Thank you.